Hello, everyone, and welcome to our live session. Today, I will be going over a quick starter presentation before we begin to welcome you all and introduce you to our program and the various opportunities we offer if you have, of course, not previously attended any of our shadowing sessions. I do want to highlight that Pre-Health Shadowing is a student-led, minority-led, women-led nonprofit dedicated to helping prospective healthcare professionals gain access to educational resources, no matter the demographic status, abilities, or location. My name is Jesus. I am the Chief of Program Planning here at PHS, and I want to thank you all for attending today. Let's get started. Here we go, okay. Just a little PSA, we do have closed captioning for all of our sessions to accommodate all students. This setting is available on the bottom of your Zoom screen, and if you need any assistance enabling the transcript, please direct message one of our team members. We are always looking for ways to be more inclusive and ensure our sessions are accessible to everyone. So please, if you have any recommendations for how we can improve, you can definitely email us at info@prehealthshadowing.com. So since this is an international program, we want to know where are you guys Zooming from today? You can drop it in the chat. Okay, I see some people are already answering the question. Okay, wonderful. We have few people from all over the US. Okay, wonderful. Thank you so much, you guys. I myself am calling in from Puerto Rico and the Caribbean. So if you want to stay in the loop, you can follow us on social media. We are active on both Instagram and TikTok, or you can also sign up for our email list on our website to never miss a session. We do have some wonderful opportunities for you all as benefits of being part of our program. So if you were by any chance looking for research experience, I am excited to announce that Pre-Health Shadowing is launching a research program that will allow students to connect with principal investigators as they conduct research in various topics, fields, and locations. This program is 100% remote, which means you have the power to connect with absolutely anyone. This is an 8-week program that will begin on June 21st. And for more information, you can fill out the interest form that was sent in the chat below, and we will definitely get back to you as soon as possible with any additional details. We have also partnered up with Kaplan to get our students a 10% discount code that can be used on all Kaplan products as well as free resources, such as study guides to help you prepare for your standardized tests, such as the MCAT, the NCLEX, or the PCAT. If you fill out the short survey in the chat, we will definitely get you signed up for these deals for free, I'm sorry. We would also like to draw your attention to another amazing program, that being Neolith. Neolith is an online mental health platform for students. For pre-health professionals, especially, we know that the path isn't easy, so that is why we have partnered with Neolith to spread the word and offer free access to their services if you use the link in the chat or enter the code PREHEALTH when signing up. Additionally, we are really excited to announce that we have partnered up with Krispy Kreme for you to purchase one delicious dozen donuts to enjoy with your loved ones. With a donation of $10, you'll be able to receive your treat while also helping us here at PHS. More information and instructions about it can be found by clicking the link that was sent in the chat. We also just got our PHS merch, which is wonderful news. This is another way to help our organization and acquire a really nice piece of clothing, that being t-shirts, long sleeves, or hoodies in the process, so you can represent PHS and our mission. Mask for Mask is another amazing women-led organization that donates 4 masks for every 4 masks sold. These go to people in need during the COVID-19 pandemic, those in the homeless community, healthcare workers without their proper PPE, and others who are struggling to stay safe. With our discount code PHS15, you can get 15% off your order. If you buy through this method, pre-health shadowing will also get 10% of the proceeds, which is amazing because, as I mentioned earlier, we are a nonprofit that runs solely off of the support of our community. If by any chance you want to play a bigger part in supporting PHS, we would love for you to join our network of student volunteers and team members. You can apply to be a part of our administrative team and lead students in various projects and initiatives with professional outreach, grant writing, and a lot more. We understand, of course, that as a pre-health student, you may not have the time. So we also offer the opportunity to volunteer asynchronously with tasks that can be done on your own time. We would definitely love to have you be part of this program and contribute your own unique perspective to us. Great news, if you are a high school student and you want to get involved, we have also started a program called HTP, or High School Training for PHS, which allows you to connect with college pre-health programs, get involved in fundraising for PHS, and also organize resources for other high school students that are interested in medicine through pre-health shadowing. Here at PHS, we love to recognize the hard work of our students in the program. So if you are interested in getting published, you can submit essays, reflections, research papers, and reviews to our editor-in-chief through the link dropped in the chat to have your work published on our website. This will definitely look great on CVs, applications, resumes, etc. So do take advantage of it. Part of our mission here at PHS is to promote diversity. And in order to do this, we have launched an initiative to have monthly panels to celebrate different demographics in the field of medicine. Some of these upcoming events include a series on patient experiences, a COVID-19 roundtable, and International Student Forum. If you have a mentor, professor, or professional that has inspired you in any way and you think they could contribute to these conversations, please do nominate them today using the link that was dropped in the chat. If you can, we also humbly ask that you donate to our program. As I mentioned, pre-health shadowing is completely student-run, and we are working around the clock to keep this free and accessible to everyone. Unfortunately, Zoom and our website are not free, so any contribution you can give would be greatly appreciated. If you are not financially able, we request you send this link to someone you think can, so we can continue to support those who cannot afford similar opportunities. Throughout this session today, we encourage you all to drop any questions you may have for the speaker in the chat. Our team members will be making note of these to be asked in the latter half of the session, that is the Q&A session. I would also like to encourage you all to take good notes as our professional is going over their presentation, as there will be the chance to make a post-shadowing assessment to verify your virtual shadowing hours. More information will be available on this at the end of the session, so stay tuned, you guys. Lastly, if you can, we request you turn your cameras on. This is by no means an obligation, as we are respectful of different circumstances, but it does help us feel closer together in a time when socially distancing is mandatory. We also request that you make sure to mute yourself, as this will ensure the professional has the complete and full attention from the audience. I appreciate you all for listening, and now I would like to welcome our professional, Wesley Cayabyab. Thank you so much for joining us today. You may share your screen whenever you are ready.
Thank you, Jesus.
You're welcome.
Okay, so sorry, let me get this going here. Okay, so welcome everyone. So my name is Wes Cayabyab, or Wesley Cayabyab. I go short by, with Wes. So I'm not a physician. I work in medical education. I'm actually more in emergency medicine. I am a EMT and paramedic, and I've been doing that for a very long time. But I'm really more here to talk to you today about medical simulation and what I do as a simulation technician for the University of California, San Francisco. And we do this at the Canberra Center for Simulation and Clinical Skills, right? So let's get into, sorry, there it is. Okay, so quick disclaimers. So I'm receiving no financial compensation for this. This is an original work. So this talk is not directly affiliated with the University of California, San Francisco and its affiliates. And fair warning, so some of the images that you'll see are graphics, so just a little bit of a heads up. So really quick outline. Right, so we'll just do a really quick about me, and I'd like to get to know you a little bit to just figure out like where some of your interests are, and we'll talk a little bit about what a simulation technician is and why I got into it. We'll go into a little bit of the background of medical simulation and medical education, and we're going to go into a really quick lightning round, and that's a game for you all. Right, and then we'll talk a little, just briefly about the journey to a simulation technician, and we'll also do like a day in the life of a simulation technician. And that's not a typo. I actually do mean an atypical day because there really are no typical days as a simulation technician. We'll talk a little bit also about the summer internship program that I started about maybe like 5-6 years ago, and then we'll do a really quick Q&A. All right, let's jump right into it. So. Where are you from? We've already seen that, but I'm really interested to see like what some of your interests are, medical, non-medical. Let me see if I can pull up my chat window. Right, so I'm really curious to see what you guys are all interested in. Chat. Okay, well, I can't get my Zoom chat window up. Sorry.
Okay, so we have Samantha over here saying that they're interested in obstetric and gynecology, and they are from Delaware. Alakia, I'm sorry if I mispronounced your name. Their non-medical interests include poetry and dance.
Nice.
This is some of our audience members answering your question.
Cool. All right. So this is actually really good because I tend to work with a lot of different disciplines, and we'll talk a little bit about that in a second. And the reason why I ask about some of your other non-medical interests is because doing this kind of work as a medical simulation technician, especially in a school as diverse as the University of California, San Francisco, you have to have a lot of feathers in your cap, right? And especially to do the job well. Right. So really quickly about me. So I own and operate my own theater company. I'm also a stage, film, and television actor. I'm also a dance instructor. And like I said before, I also work in EMS. I am an American Heart Association instructor. I attended Lewis and Clark College, and I'm currently working on my BA in Healthcare Education and Management. So again, just seeing what some of your interests are, because it kind of works here. Right. So, and again, the major reason why you need all of these different things is because medical simulation is really the intersection between medicine, education, and the arts. It really is, right? And we'll delve a little bit deeper into that later. But think of it this way, right? So when you're simulating a patient, either through a mannequin or as a standardized patient, and we'll talk about what standardized patients are, you're simulating the whole patient, right? So not just the disease, right? So when you're simulating a whole person, it becomes a performance, right? And think of it this way, words when spoken aloud for the sake of performance, they're music, right? They have rhythm and pitch and timbre and volume, and these are the properties of music. Music has the ability to lift us up and move us and lift us up in ways that literal meaning can't. Now, I can't take credit for that. That's from an episode of the Wesley, unfortunately, but love that phrase, right? So your performance as a mannequin operator can and should move people, right? Your performance as a standardized patient should absolutely connect and move people, right? Because if you're not connecting with your student and you're not connecting with the people that you're technically instructing, it's not working. All right. So you also get a chance to work with a wide variety of colleagues and disciplines. I work with School of Nursing, Physical Therapy, Dentistry, Radiology, Anatomy, Hematology, Global Health, Obstetrics, right? I work with all of these different departments because they have to use variations of simulation to really do their best to instruct their students in all the various ways that they possibly can, right? Because remember, when you're starting out in medicine or starting out in the medical field, they're not just going to unleash you or foist you out there into the public with no training, right? So you're going to start training with us. You're going to start training with simulation and simulation technicians. I personally really enjoy working with the various pathophysiology that is widely different, especially between all the different disciplines. Because I work with emergency medicine a lot, and emergency medicine physicians and technicians, we see so many different cases and pathophysiology that would blow your mind. And you need a lot of different skills and knowledge to really make your simulations and to make your interactions sing, right? And this is a very, very, well, not very new, but it's only been around for, I want to say, maybe like the last 20, 30 years. And we'll talk a little bit about that later, because right now we're really on the cutting edge of medical education and training. So, okay, what is exactly medical simulation? Let's really get to the brass taxes here, right? So there's really three main ways of doing medical simulation, right? So you've got mannequin-based simulation, right? Like a high-fidelity mannequin, which is basically a full-body mannequin that's from head to toe that is built out of plastic and computers, and I'll show you that in a second, right? Then we have partial task training, which is parts of human anatomy that has been turned into a model so that you can work with it and practice on it, and we'll look at that in a second. Then standardized patient-based training, which is actually the very first version or iteration of medical simulation, right? And then you've got hybridized simulation, which combines mostly mannequin and standardized patient training, but also a little bit of partial task training as well. So let's get into a really, we'll get into a brief history of that in a second, but let's dive deeper into each and every one of these. So this is mannequin-based simulation. All right, so it's using this mannequin, right, to inject medications, to bag valve mask ventilate, to place an endotracheal tube, to do team-based training, right? So in this video, so it's a computer-based or computer-driven mannequin, right? And my job is to operate the mannequin from behind the scenes, right? So I'm actually, I'm working with a facilitator on the floor who's watching basically from afar and trying not to interfere with what's happening with the actual participants. And we're doing our best to coordinate with whatever these students are doing, right? Be it they're doing everything correctly or doing everything incorrectly, right? Really, we're not so much worried about them doing things well. What we're more concerned about is what happens, right? So we set it up as a very, very safe environment where people can fail. And that's what we're looking at. We're looking at different ways that people fail, right? And then getting people to recognize that later on down the line. And doing our best to minimize those errors and failures getting to an actual patient, all right? So partial task training, right, is what I mentioned before, right? It's basically parts of human anatomy that are plastic, that have been turned into models where you can learn how to place an IV or place an intraosseous needle, right? So here you actually see me actually instructing some students how to actually place an IV, but before they actually place it on an actual person, they're going to do it a number of times on this piece of plastic, right? Because a piece of plastic isn't going to yelp and pull their arm away, right? Whereas an actual person may, right? So, and then on the other side of your screen, you're watching a nursing student placing an intraosseous needle into a bone, right? And again, these are procedures that when you're a novice, you don't necessarily want to do it on an actual person or a cadaver, because, well, on a cadaver, it's really expensive. And then on an actual person, if you make a mistake, that's a big problem, right? And we'll talk about medical errors in a second. So standardized patients. Standardized patients was actually how all of this got started, right? Standardized patients are actors that are specially trained to portray patients with specific ailments so that our students can practice how to perform a variety of tasks like gathering an H&P or history and physical exam, and practicing motivational interviewing, delivering bad news, dealing with language barriers, cultural barriers, dealing with difficult patients. I was actually a standardized patient myself way back in the day, and I played a variety of different patients. So really quickly, right, what exactly, what is the history of medical simulation? How did it get started? Where did it come from, right? So back in 1929, Edwin Albert Link basically put a bunch of instruments into a blue box, and he created the very first flight simulator. So simulation was actually started back in the days of aviation, where there weren't a ton of planes available for people to start training in. And in fact, to actually get into an actual cockpit, it was pretty costly. So this flight simulator was both cost effective, and it could simulate different environments and actually put pilots into simulated dangers in the air. And then in the 1960s, and that's a huge jump, standardized patients were born. Right, again, so these are actors who were finally brought out of theaters and movies, and were trained to deliver scripts, lengthy scripts, and portray these cases. And that's when medical education started to use that for skills evaluation. And turned it into the observed structural clinical examination, or the OSCE, which some of you will eventually get to if you are going to go down the route of medicine. You are going to be testing in the USMLE, and the USMLE uses OSCEs. They use standardized patients to gauge how well you're doing, right? And whether or not you've really gotten a grasp of everything in your first year of med school all the way to your fourth year of med school. And you're even going to get a chance to do some of this in your residency as well. So then in the 1980s and the 1990s, Dr. David Gaba, who is kind of considered like the godfather of mannequin-based simulation, came up with CASE, or the Comprehensive Anesthesia Simulation Environment, which is basically like the blue box, where he took a bunch of these, a bunch of waveform generators and plugged them into monitors and plugged them into anesthesia machines and simulated a patient, right? But without a body, right? So he just took all of these random components and put it into all these monitoring devices for anesthesiologists, and created a human, right? Except there was no human. So that's when a manufacturer watched and saw what Dr. David Gaba was doing and came out with a full body mannequin that took all of that stuff and put it into a human body form, right? And there's one of the very first mannequin creators was Laerdal, and then another one was Medi, and these are all different versions of basically the same idea of the blue box, right? And that's when we started using CRM, or crisis resource management, and again, that comes from the aviation world. And CRM training is really designed for airline pilots, so that they can change conditions that induce errors, and using non-technical skills that can prevent those errors from occurring, right? And using things like optimal communication, teamwork behavior, things of that nature, right? And that's what crisis resource management is all about. And we use that now, especially for when we're training a lot of our residents, especially in the simulation, in the simulation suite with our big mannequins. Then in 2000, the report To Err Is Human from the National Institute of Medicine came out, and that really brought to light like the number of deaths that were due to medical errors. And that number exceeded the number of breast cancer and AIDS deaths combined. So I mean, that's 21 years ago where we identified that medical errors were basically 1/3 the cause of death in the United States. So that's why medical simulation really started to ramp up. And then the international patient safety movement called for the raising of safety and quality of healthcare, which really pushed a lot of medical education, education societies and medical education institutions to find other ways to put patient safety and harm reduction at the forefront of their education. Right, and that's again another reason why medical simulation has really sprung to the forefront of education. And then in 2007, virtual reality and augmented reality really kind of like pushed a lot of what we do in simulation and brought reality and fidelity to basically made it more accessible and allowed a lot of our learners to train in a fashion where they're going to be practicing in real life. So as a simulation technician, right, so brass tacks is like I work with faculty to build and create scenarios. I build partial task trainers, right? I actually 3D print those things. And I maintain and repair quote unquote equipment, right? But if you really look, I mean, I'm diving deep into the guts of a mannequin, or I mean, that's what I do, right? I perform in situ simulations in the hospital, and I collaborate with technicians and centers around the globe. I work with a couple of different universities in Uganda, and a couple of, and one or two over in Australia, and a number in the UK. But let's get to my broad definition of a simulation technician. My job, the way that I see it, especially in the last 10 years that I've been doing this, my job is to eliminate barriers so that both faculty and students can focus on doing their best. That's my job, right? And it very much falls in line with the mission statement for my theater company. And it's about giving a voice to the voiceless, elevating those around us so that we all may rise and be successful. So this is an environment where I'm excited about mistakes and errors. I'm not at all interested in the correct answer. So what fascinates me, what gets me out of the bed every morning is fostering the journey to the correct answers, enabling discovery and helping people get out of their own way. That's what my job is all about. And that's why I work as a simulation technician and why I'm in education. It's to help people find their way by a variety of means. Okay. So we're going to get into our quick lightning round here, okay? So I'm going to actually put you into quick little simulation here. So 2 quick scenarios. So the first one, so ground rules first. So again, you're going to answer yes, no, it depends, or maybe. There are no right or wrong answers, right? So just throw one out there, right? So there are no points assigned. Think of this more like a personality test, right? Simulations should be seen as a personality test rather than assessment or an evaluation, right? I don't like to see it that way. A lot of faculty don't use simulation that way, right? So it's all about what happens, seeing what comes up and what you respond to and how you handle yourself, okay? So I'll read out what each scenario is, right? And then do your best to answer as quickly as possible, right? Try not to think about it too much, all right? Here we go. Okay, so round 1, you're a standardized patient. Okay, you are working as a standardized patient. So the case that you're portraying is of a 20-year-old patient who is being abused by their partner. Now your affect, or how you've been trained to play the role, is sullen, scared, and slow to answer questions. Your student provider, right? Basically, the if you're looking at the picture, the student in the white coat sitting and interviewing you, right? They're a second-year med student or a first-year nursing student. They don't have a whole lot of experience. So they have 15 minutes to figure out why you came into the clinic, and they've already spent half that time establishing rapport with you. So they only have maybe like 7 to 5 minutes left. So they're clearly being affected by your heightened emotional state, and they're pretty close to crying. Now, do you follow your training and potentially make the student cry? Yes, no, it depends.
Okay, so we do have a few people answering yes up to this moment. So some audience members are also answering it depends. Yes, and it depends. Those are most of our answers over here.
Wow. Oh, this is interesting. I love this. Okay. So for those of you who answered yes, you're absolutely right. You're absolutely right. Because yeah, pushing a student to the point of crying, it's not necessarily the worst thing, because students eventually are going to have to learn how to work with their own emotions, and crying with the patient or in front of the patient isn't necessarily a bad thing. Right? But there is also something that we have to think about working as a standardized patient. Am I pushing the student too far to the point where they're not going to learn anything? Right? So it's the Yerkes-Dodson law, right? I don't have a graphic for this, but it's basically a curve that looks like this. Right. So it's the idea where if you're pushing your student, your patient, your student provider right up to this point here, where they're just activated enough, right? But if you push them over the edge, right, now they're getting too stimulated, and now they can't learn optimally, right? So this is one of the biggest things that we deal with. Both as simulation technicians and as standardized patients, we have to really gauge how far to push people, right? And to keep it challenging, right? And for those of you who said it depends, absolutely right. Well done. Yes, right? Because it all depends on how your student is. Because what if your second year med student or your first year nursing student was a hotshot, right? And they're just on top of everything, right? And they're not affected by your emotional affect at all, right? Then maybe you ramp it up a little bit, right? Or you tone it down and you move on, right? So it's all about reading the room, reading the student, and making quick decisions, right? So you have to have a lot of critical thinking skills here. It's not just about how you were trained. It's about your quick assessment of the student that you're working with, right? And it actually has a lot to do with especially like emergency medicine too, right? You need to make snap decisions and make quick assessments as you go. All right, you ready for round two? Okay, round two, you are the mannequin operator, right? So you're behind the scenes, like operating this mannequin, right? So you're working the computer, right? And you're watching everything remotely, right? Now you're working with an emergency medicine facilitator, okay? Now your students are first year residents. They're interns, right? So they've finished all 4 years of med school, and they're in their very first year of their residency. Means that they haven't had a whole lot of experience in the hospital or in the actual department. All right. So all the scenarios that you've been simulating, they're all new to these residents. They have no idea what's coming next. All right. Now, this particular scenario is of an 80-year-old male who choked on his lunch after coming in for a routine procedure. All right. Now, the residents are doing their absolute best with the experience and training that they currently have. But according to what's written in the scenario or the script, their actions are not enough to adequately resuscitate this patient. Now, the facilitator is busy watching their students and evaluating what these students are doing. Right? So the facilitator can't tell you what to do. You, as the mannequin operator, you're left to make the decision. Do you kill the patient? Yes, no, it depends.
Okay, so at the moment we do have a lot of yeses. Yes, yes, they're all yes.
Ah, that's very interesting. So I did this with a bunch of nursing students who and I got a lot of no's and it depends. And then for people who are actually more like on the critical care side of things, who are especially like EMS, emergency medicine, like critical care pediatricians, they all said yes. So this is actually a really interesting cross section to see. So remember what I talked about the Yerkes-Dodson law, right? So really finding that point of like like maximal input before people stop learning and stop actually being able to perform or function well. So keep in mind, these are very, very brand new residents, right? So you're riding this tightrope. All right, so if let's say that this was, this one's a good one. So let's say that these were first year residents in pediatrics. Does your answer change? Yes or no?
Okay, so at the moment there's a lot of no's. Yeah, no, their answer does not change.
So there's a lot of research on this particular topic, and I've kind of experienced it myself. So for people who are expecting certain things, especially when you're walking into a critical care environment, you're going to expect that you're going to lose people, absolutely, right? But when you're walking in on your very first day of your residency, it's actually kind of interesting to see how people respond in this particular scenario. When we kill the mannequin, we actually start to see students where they focus on their failures. They focus on and they kind of spiral into this whole idea of like, what did I do wrong? Or I should have seen that sooner, or these are the things that made me fail. As opposed to looking at the whole picture and looking at the whole team, right? They get very they become very insulated, and they go back to, what did I do and how did I fail, as opposed to we're all working together, and half the time, well, a lot of times, your patients insist on dying. So it's a really, really interesting conversation to have. And when we get into pediatrics, that's where we're killing your patients actually, well, as a simulation technician, sorry, that's where killing your patients really, really rides that tightrope. Are these students able to handle it, right? Have they gotten enough training and experience to handle losing their very first patient, even though it's a simulated patient? Here's the thing with this. When you actually get into this actual room, into the simulated environment, it feels real, right? And my job is to make it feel real. It's to put the pressure on. So now I can't read the room, I can't see you all, but have you all heard of the frog in a pot? So it's basically the idea of you put a frog in a pot of cold water, and you gradually turn the heat up, right? The frog won't leave, right? The frog will just sit there and boil, right? Whereas if you turn the heat up and try to put the frog in a pot of boiling water, it jumps out immediately, right? My job is to slowly turn up the heat, right? My job is to slowly put you into that environment so that you can figure out how to operate optimally, right? That's what we do as simulation technicians. And if I put you in, if I turn it up too hot and kill your patient, there's a chance that you may not come back, right? There's a big chance that you may not be able to pull yourself out of that tailspin of, oh my God, I failed so hard, all right? But therein lies that question of, maybe that's a good lesson to learn, right? So failure to me, especially as an educator, failure to me is, it's a verb. It's not a noun. Nobody is a failure, right? So failing is just another data point, right? And my job is to make you feel safe enough to fail, right? So well done, you all. All right, so some of the skills needed to succeed here, right? So you need a basic knowledge and experience in medicine, right? A little bit of experience in IT, right? So now clearly you need a little bit of a flair for the dramatic, right? So a little bit of theater, film, television. You need some kind of production experience, right? Because you are building an environment for your students and for your participants to be able to not necessarily test, I don't like using that word, but to really see what you're made of, right? And see how well you do, right? And you need to understand how to do some moulage and effects makeup, and I'll show you some of that in a second. You need it's like some medical equipment handling and maintenance experience, some basic stuff like that, right? And then inventory management. Because you're dealing with a lot of stuff, right? Because you need a lot of stuff to teach people, right? And critical thinking is really, really top on that list. So let's go really quickly into like what a typical day or an atypical day is in my life. So a lot of it is laying out partial task trainers. Like here we have I'm building a pediatric model so that some of our emergency medicine physicians or pediatric emergency medicine physicians can learn how to place a chest tube on a child, right? Because I personally wouldn't want some of these individuals doing that on my kid if they actually haven't done it on a piece of plastic, right? So I built this for them, right? Here I do a lot of collaboration with a lot of different departments. Here we're actually working with our anatomy lab, where they're 3D scanning some parts that we have so that they can actually use it in their anatomy lab. Right. And it's a lot of collaboration. You got to work with so many different departments. And that's actually one of the things that makes this job really exciting and interesting is you never really know who you're working with on a day-to-day basis. And here, so I was collaborating with our library makers lab, where now at the height of the pandemic, there was a big PPE shortage, right? So working with our makers lab, we 3D printed face shields, right? And we did a whole project on basically creating PPE, not just for our hospital, but for hospitals across San Francisco. And we sent out a lot of these as well. And again, this is just a bunch of the stuff that I 3D printed actually in my own shop. For a number of different people who needed specific partial task trainers. A lot of these bones were used for placing intraosseous needles, and that particular procedure is basically taking a 14 gauge needle. It's kind of big. It's like a small drinking straw, and boring it into a bone so that you can push fluids through it, and you could fluid resuscitate someone through. Well, these are tibias. And so it's something that requires a lot of practice to do well, right? So that's why I've printed so many. And here we have a little bit of moulage, right? So moulage is basically effects makeup, right? That you apply either on a standardized patient or you apply on a mannequin, right? So this is my work wife, my colleague Jenny. She and I were basically practicing how to do some of the. I think she was doing more of like a burn, and I was doing a gunshot because we were practicing on each other, and she actually did a really good job on my hand. My burn is a little on the small side. I should have kind of like spread that out a little bit. But again, this is how you learn how to do things, right? And this was the end result of placing it on our actual mannequin. Sorry, that's actually my hand on the other side of the screen. But putting the gunshot wound on the mannequin, again, it's to make the simulation as lifelike as possible, right? So that's what we do, right? And quickly, just to talk about the summer internship program that was started here at the University of California, San Francisco. I started it back in 2014. It's really all about giving students like yourself exposure to nursing, medicine, medical education, and you get a chance to actually author some simulation cases and to actually play as a standardized patient. I train you how to do all of that stuff, right? And it really gives you a chance to think critically and see what it's like to be a medicine student, a pharmacy student, a nursing student, and one of the biggest things that you get a chance to do is work with nurses and train nurses, right? So what you're actually seeing this little video here is some of the summer interns that I trained how to do this, right? Because this is my bread and butter. That's what I do. So I trained them how to do it, and then I'm just watching them do their thing. Eventually, when they do come back, because we have senior interns who end up becoming mentors, right? And they mentor younger people who come on board, and then I get a chance to relax a little bit, right? So it's this idea of getting as much exposure to all the various departments that we have on campus. And again, not everybody needs to be adept in medicine when you're coming into this particular internship program. I've had summer interns who come on board and turn around and say, actually, Wes, I wasn't, it's like I'm really not all that interested in doing medicine anymore. It's like, that was a really cool experience, but yeah, I'm kind of cool. Okay, right? I want to do something different, right? But what they gain from that, and I actually have one of my really good well, he's become a good friend. He's become a renowned chef, and I don't want to say his name out loud because he'll soon be out there in the world doing really good things. And he flat out told me that just learning how to run a code blue, right, or resuscitated patient, taught him how to operate in a high stress environment. So there's a lot of different things that you're going to learn that people learn in this summer internship program. And all in all, it's not all serious, but we have some fun and games, but it's good stuff. Questions?
Okay, so I believe we can now start with the Q&A session. If you would. Okay, so let me look for the question. Okay, so for the first question we have over here is Samantha. How do you see simulation technologies changing in the future?
Yeah, we've already been seeing that, and that's the interesting thing about all of this. So, if we all remember back in the days when Google Glass was was trying to come out, and it ended up not, it kind of like petered out. It's this idea of using augmented reality so that you can also collaborate with people who aren't necessarily at the bedside, and we're seeing a lot of that especially in training with anatomy, because when you are going to when you are enrolled in an anatomy program, it's actually pretty costly. And it's pretty costly for us as well, because each donated body requires a lot of preparation. It requires a lot of tending to, and you have to store it, and when one or two students work on it, you're only working on half of the body at a time, but then you're basically destroying what you're using. Right. And even if you're using a partial task trainer, something in plastic, it's the same thing. You're destroying what you're using. So what we've been starting to kind of move in the direction of is using augmented reality and using haptic devices to actually do dissections and things of that nature. We're also using a lot of Zoom, right, to do some of our simulation scenarios. Well, again, mainly because of the pandemic, necessity being the mother of all invention. Using Zoom and using different forms of virtual reality to kind of up that reality and up our game a little bit. And if you're really interested in some of this mannequin technology, it's kind of eerie how more lifelike they're getting. Like the skin texture is feeling more and more like skin. Their faces can actually emote and show pain. Like the mannequins that I work with, they bleed, they sweat, they cry. You can talk through them. They can vomit. They can urinate. They can do all of these things, and that stuff's just getting more and more and more real. And I'm a little bit of a mixed bag with that, because I'm like, some things I don't necessarily want real, right? But that's kind of the direction that most, if not all, of our simulation technology is moving towards. It's towards making things more real.
Okay, that is actually wonderful. That's very, very interesting. Thank you so much for answering that question. So another question that we have over here is, how long does it actually take to become a medical simulator? What steps do you have to follow?
See, that's a bit of a tricky question, mainly because it's going to depend, it's going to vary depending on the institution. So the University of California, San Francisco, there are a couple of different tiers, right? So there's like an entry-level position where you're basically more of an apprentice rather than I mean, I basically kind of created my job, right? Let's be honest here, right? Mainly because I brought so many different expertise from so many different places, and I put it together and turned it into this educational tool. And I can count on one hand how many people can actually do that currently. So so gathering some of those expertise takes time, right? So for people to really understand how to instruct students, you need a little bit of an education background, but you also need a little bit of experience from the theater and production world, so that you can make that as real as possible, so that you can really make those tools work. But you also need a little bit of a medical background, so that you understand what you're instructing and what your instructors are using. So it's 3, maybe 4 different worlds colliding. And for me, it took, I want to say maybe like a good 5 or 6 years between like some undergrad work and actually working out in the field to really get to this place where I can make this tool super robust. But like I said, you really can walk into certain institutions and come in as an apprentice, or come in at a really low level and then build up your skills as you work.
Okay, that is great. It's a very interdisciplinary sort of field. Um, so along that line that you did mention, there's like a lot of theater technical going into it. So one of our audience members, Samantha, asks, have you worked in theater before becoming a simulation tech?
I did indeed, right? So theater is my bag, right? So theater to me, and again, just strictly my opinion, theater will always be the actor's stage. You go back to to my friend Bill Shakespeare, and I call him Bill because if you've known him as long as I have, all right. So for Bill Shakespeare, it's 2 planks and a passion, right? That's all you need. And theater is like the gateway to any kind of making, any kind of like of oratory skill, any kind of anywhere where you need to present yourself. And it's one of the best and fastest ways to be exposed to so many different perspectives and so many different worlds. So absolutely. I mean, I worked in theater when I was in college, especially. I spent a lot of time as a theater designer for sets, not necessarily costumes. Costumes I'm not so good at. I'm just not good at sewing. I mean, I can suture. I can suture skin really well. When it comes to fabric, not so good. And I know how to upholster really well. Building sets, and then that quickly moved me to the front of the stage. And I was always on stage in high school as well. And then outside of college, I was working for a number of different theaters, working for the scene shop and working for they're like a model shop as well. And again, these are skills that you really need for to build like some of these anatomical models as a simulation technician, right? And then outside of that, I worked with a number of different theater companies to bring like a number of different shows both on and off Broadway, and that's how I ended up building my own theater company.
That is great. I completely agree. Theater, I'm sorry, definitely helps you develop lots of skills. I myself was a theater kid in high school, and I absolutely loved it. Because of college and undergrad, I haven't had much time because, it's a little packed, but I definitely want to go back. I really miss those days, and it was an amazing experience being part of the theater community. It's really, really nice. So we do have another question over here, and has Wesley starred in any movies?
I have. Oh, okay. It's a little bit embarrassing. So I've been in a couple of different movies, and my credits are few, but they're out there. One of them is actually a project I worked on a very long time ago, and it was with the LGBTQ community where they were just looking at more people of color working out in media and in the arts, and so I was one of the prominently featured actors who were of different color. I've been in a ton of different television commercials. I've kind of like lost track at this point, and my theater resume is quite lengthy as well.
Thank you so much for sharing that experience. That's really, really cool. I love how you I'm sorry, how you've been part of lots of different fields. That's really, really interesting. Okay, so another question we have over here is, okay, how does the uncanny valley affect medical simulation, especially in things like virtual reality?
I'm a little. I'm a little. I may need a little education on the uncanny valley affect, actually. But I do know that that medical simulation in VR, it's still really new. I mean, really new, and which is why we at UCSF, we don't really use it a ton, mainly because it just requires a lot of gear, right? And it requires a lot of like physical presence, like to actually use some of this virtual reality stuff, we actually have to have our students physically on campus. And again, with COVID, couldn't do that. Or we would have to ship the gear to students. So that's why we really haven't adopted VR as readily as some places. But yeah, I might need a little bit of education on the uncanny valley effect. Yeah.
Okay, thank you. Okay, so another question we have over here is from Ashvin and Alikia. So what do you believe is more important, personal feelings of the students or the learning experience of the students?
That's a really good question. Thank you for that. So I've been in medical education for a long time, and the noble lie in medical education is student experience should trump everything, right? It's all about the student experience, but that's the noble lie, right? Just like the noble lie in psychology where people don't change, but we all know that people change all the time, right? So so in medicine, they both matter and they both don't matter, right? So so the student experience to a fashion really does actually kind of inform what's going to happen next, and what's going to happen, what's going to inform what may or may not happen with your patients, right? But at the same time, not necessarily, right? Things change on like on an hourly basis, on a minute to minute basis. I experience this a lot, especially when I'm working with my emergency medicine residency. Like they're over there simulating something, and we flip the patient into a really lethal rhythm, and we're really doing our best to amp things up and make them feel like they're right in the heat of the moment. But we also notice that that they're withdrawing a little bit, right? That they're not as engaged because maybe they're preoccupied by something, or something isn't quite making sense, right? So that's when those two worlds don't necessarily mesh, right? So we do our absolute best to take care of both at the same time, but we do tend to default on how a student feels, right? So in that particular scenario, that's where we back off a little bit. We let the patient or the mannequin or the patient simulator stay in a lethal state for a little bit longer, right, and trail things along until the student starts to kind of feel a little bit more not engaged, but more confident with what they're seeing and what they're feeling, right? Or a really good facilitator will put a pause on things, and they'll just say, time out for a second. What are you feeling? What's going on? Right? And take a hot second to just reset everything, right? And then recalibrate, right? Because like I said, we both care and don't care, right? But in that moment, right, we gotta pay attention to that Yerkes-Dodson law, right? And bring that level of excitation down just a touch, right? Just so they can start operating optimally again.
Okay, wonderful. Thank you. Thank you so much. So another question we have over here, it's a little bit more relating your undergrad. So what did you study in college? Asks Samantha.
Ooh, okay. I'm a little bit embarrassed here because you're all going to look at me and just go like, oh my God, another overachiever. It's like, yes, I was a major overachiever. So I went to an international baccalaureate high school, and that's where that's where my overachieving really just kind of like through the roof. So I was a theater and psychology major with an emphasis in pre-medicine, and working as an EMT. So I can see on Jesus's face, like, how did you ever get a chance to do anything in theater? Right? Yes, you're correct. So I would basically sleep maybe like 2 or 3 hours because I was either on stage, or I was working a shift, or I was in the scene shop designing a show, or or I was working in the scene shop building a show. And then when I wasn't doing any of those things, I was in class. I was burning the candle at both ends. It was a lot. And to a degree, when I really think about it, it's just like, okay, I see what I was doing. I was kind of hedging my bets. But if you also look at it, everything that I did in my undergrad really kind of pushed me into this job and pushed me into this role. So me kind of pushing that hard in my undergrad years kind of did me well.
Oh, I believe that's great. I actually feel inspired to keep going on with theater right now. I've actually thought about it since I'm almost graduating. I've really thought about going back into theater.
That's the best time to do it.
Playing my last play before I go.
You gotta jump back in. That's the best time to do it. Like your freshman and your senior year, those are the best times.
I'll definitely take that into consideration. Thank you. Okay, so another question that I believe is very important right now regarding what you just said. What are some tips you have for time management?
Thank you. Right. So here's the thing. Okay. So uh, um, I'm going to say this from two different perspectives. Okay, so I'm going to say it from the perspective of like the current job that I'm working, and I'm also going to say it from the perspective of a college student because I'm I feel you. I've been there, right? So from the current job that I'm working, as much as I am passionate and love this job, I also have to understand that at a certain time I'm done, right? So basically, from 7:45 until about maybe 5 o'clock or 6:30, that's all work time, right? And then after that, I leave it there, right? So I can't take it home with me, right? So all of that stays at the center, right? And that's why I do my best to really compartmentalize those things, right? Because yeah, I mean, I work as a dance instructor as well, and I'm still doing all these other things on the side. And really it's about setting clear boundaries for yourself and for all the demands on your time. Um, so so doing your best to say no, right? That's one of the biggest things. Learning how to say no, right? And that's actually a lesson that I've been learning over the last maybe I want to say maybe like 15, 20 years, because when you're coming up in whatever role that you're coming up in, right? So if you're working in nursing, you're working in physical therapy, if you're working in pharmacy, right? So you're a novice, and you want to say yes to every opportunity that comes your way because, well, A, you're afraid that it may not come up again. B, you're afraid that if you don't say yes to it, someone else will, right? But it's also this idea that uh, that knowledge won't be around if you don't say yes to it. And I'm gonna tell you that again, it's that noble lie. It's true and it's false. Because here's the thing. Say someone comes up with two different opportunities. Opportunity A is you work a fellowship program where you work your tail off, but get no pay, right? You get a lot of experience in that one particular field. Let's say pediatrics, right? But it's inflexible, right? That means every free hour that you have, you're working in that fellowship, or you have something like my summer program, where I don't care when you show up. All I care about is when you're with me, and when you're here, you're doing your best to soak up all the knowledge that you can and whatever opportunity I present in front of you. Which one works best for you? All right. So it's all about looking for those different opportunities and seeing what works best for you. Right. So just because an opportunity is right in front of you doesn't mean you have to take it right away. Right. Keep looking. Right. And because there's always other ways of getting to point B. Right. Now, coming from the college perspective, right. So managing your time is really all about your energy. All right. And your mental health. Okay. This is coming from someone who is an overachiever. Right. I work myself to death. Right. In everything that I do. Right. So as a dance instructor, I work myself to the point where my legs lock up. As a theater professional, I work myself to the point where I'm not sleeping anymore because I'm busy rehearsing my lines, or I'm trying to build a set in less than 24 hours, or I'm trying to pull different parts of a production together as a production manager. And then in my job as a simulation technician, sometimes I just get this one thing stuck in my mind where it's like, I wish I'd done that differently so the students could have gone down this path, or I wish I'd written that differently so that different parts of the simulation could have really shined, right? So it's all about managing what you're feeling, right? And don't you ever ignore what you're feeling, right? That is going to be one of the key metrics to staying healthy, especially when you're in college. If you're feeling burnt out, you got to switch gears. If you're feeling tired, find time to rest. If you're feeling overwhelmed, tell someone about it. If you're feeling like you're on the edge, on a precipice, reach out. All right. That's all about time management, especially in college.
Thank you so much.